Now let's see what elements of the circulation that we can see on this anatomical torso. Of course, here's the heart. Coming out of the heart, we can see the superior vena cava, the aorta, and the pulmonary trunk. Let's look at the aorta first. The first branch of the aorta is the brachiocephalic artery right there, and that branches into the right common carotid artery and to the right subclavian. And then the second branch out of it is the left common carotid artery. See, that's the right common carotid, that's the left common carotid. Note that the right common carotid comes off of the brachiocephalic, and the left common carotid comes off of the arch of the aorta. Then you can't see the left subclavian. You can see the right subclavian over here pretty good. Okay? And so that's what you can see in the way of arteries up here. Also, notice that when you look in the lungs, the red are the what? Pulmonary veins, and the blue are the pulmonary arteries, because remember, the pulmonary arteries come off of the pulmonary trunk. They're carrying deoxygenated blood, and they come out of what? The right ventricle, and then the pulmonary veins, which are the red ones, drain it back into the left atrium. And so let's look at the veins. These are the common jugular veins, okay, right here and right here. Up in the head, they do the same thing the carotids do. There's an internal jugular vein that drains the brain, and an external jugular vein that drains the face and neck. Okay. This, of course, obviously is what? A subclavian vein. Subclavian vein. Then this is what? A brachiocephalic vein and a brachiocephalic vein. And the two brachiocephalic veins go into the superior vena cava. So you've got your jugular veins, okay. You've got your subclavian veins, you've got your brachiocephalic veins, and then you have your superior vena cava. Then down underneath here, let's look underneath the diaphragm. We have the abdominal aorta and its many branches to the organs in the abdominal pelvic cavity. Then we have the right common iliac and the left common iliac artery. And then they branch into the internal iliac. I doubt if you can see it, but it's a branch that goes inside. And then beyond that branch, this is the external iliac artery. And as it goes down into the leg, it becomes the femoral artery. So this is below the diaphragm. This is the abdominal aorta, the right and left common iliac arteries, the internal iliacs, the external iliacs, and then down to the femorals. Okay. And then this is what? The inferior vena cava. It's headed up to the right atrium of the heart. And then it branches, you can't see it too well, but into two iliacs. Then there's common iliacs, and then there's two internal iliacs, and then there's two external iliacs, and so on down to the femoral vein, which is in the thigh region. So that's about the circulation that we can see on an anatomical torso, because the appendages are not on a anatomical torso.